to address this crisis, we need your help. We need your partnership. We need to come together as a community and address this together for the safety of ourselves and the safety of our neighbors. So that's my message to you today, is just please continue to wear a face covering when you're outside, to socially distance, to wash your hands, and to follow the health orders and the precautions that our health officers put forward. So with that, I'm now going to turn it over to our health officer, Dr. Hernandez. And Dr. Hernandez, good to see you. And if you could please update us on the latest statistics in Berkeley, any other information you'd like to share with the Berkeley community, and then a new health order is being issued next week. So it'd be great if you could update the Berkeley community about that.
Absolutely, and good afternoon. Before I start with the numbers, I do want to send my wishes and my condolences for families and the communities that are experiencing the fires throughout the state, especially here in Northern California. Some of you may know I was health officer in Santa Cruz County, so I have former colleagues and the health officer there who have are directly impacted by the fire. Same with Monterey County. So I want to send my wishes to them and my thoughts, and any resources that I as a health officer can do for those communities. I want to publicly share that concern and offer with them, as well as the City of Berkeley residents and workers who have families who have been impacted with these fires as well. And as some of us know, some of the fire and law enforcement personnel have been deployed to help in those communities as part of mutual aid. So we continue to do that as a community, as a city, and I just wanted to mention that and thank everyone for their help and supporting the community. So I'll start now with the numbers. For Alameda County, there are now 16,466 confirmed cases of COVID-19 in Alameda County, with 233 deaths. In City of Berkeley numbers, we, as of the 19th, we're at 484 confirmed cases with 6 deaths. That is an increase of deaths and cases from the last time I reported to you on this town hall. In terms of our, and I'll talk a little bit about the data in a second, but I will go with the numbers of our tests. We now have at least 26,964 tests reported on City of Berkeley residents, with an average 7-day average at about 354 tests per day. And that is above our target of 245 tests per day. And that number, that target, is so that we have, that's a criteria to know that we've met the level that we need to test to detect community transmission in our community. And we use that number as well as our percent positive to see how transmission is occurring in our community. And our percent positive right now for tests are at 1.95% positive, which is lower than what I reported to you a month ago, which was about at 2.2%. So a little lower. I'll take the decrease, definitely important. And as promised, I wanted to talk a little bit more about the cases and what they mean. What we've seen is, even though we've seen a rise in our cases, we've seen that it's peaked, not only for City of Berkeley, but also for Alameda County. The numbers peaked in mid-August for Alameda County as a whole, and the numbers peaked in the City of Berkeley in early to mid-July. So we've seen now a downward trend in both jurisdictions, which is definitely reassuring. We're happy to see that. We're also seeing a decrease in both jurisdictions for the percent positive that I mentioned, which is what we use to, one of the factors that we use to look at for community transmission. So both of those numbers did decrease in both jurisdictions. For hospitalizations, which is another indicator that we look at, for hospitalizations for Alameda County, we have seen the trend increasing, most notably in ICU admissions. And ICU and hospitalization admissions lag by about 1 to 2 weeks from the cases, because we know that people get sick and then they get sicker, and some need to be hospitalized or actually need to be placed in the ICU. So that lag is usually about 1 to 2 weeks. And what we're seeing now with that increase in the ICU hospitalizations kind of mirror what we expect to happen with that peak for the county. It's been about 10 days or so since the peak of case numbers in Alameda County, and that's why we're seeing the ICU admissions rise. So that being said, we're watching all the numbers as usual to assure that that we're having a good sense of what's going on in the community. And with that, we did, both jointly, Alameda County and City of Berkeley, release revised orders, health officer orders. They were released last night. They will become effective in a week's time on the 28th. And these are going to allow limited activities with restrictions. Again, our plan is to do things outdoors first, because we know that that is where it's safer in terms of COVID. We delayed the effective date because we know that it's our air quality in our jurisdictions are poor because of the fires. So we wanted to release it at a later time because of that, and also give the businesses and the communities time to prepare for the opening. So that being said, let me tell you the activities that we are allowing in both jurisdictions, and then I'll talk a little bit more about that. With restriction, outdoor pools are allowed. Outdoor personal care services, which include haircuts and services such as nail salons, services, small and outdoor practices for both all schools and college sports, live stream and live entertainment in vehicle-based settings, and outdoor wine tasting can occur. It's only wine tasting, breweries, pubs, and brew pubs are not allowed by state order. So that is why there's a specific allowance for wineries and not for any other businesses. In terms of in-person instruction for schools, that is not allowed. Everything is online, and that is exactly what's happening with BUSD. There are only some exception to the in-person instruction, which are only allowed for a very narrow group, which includes children that are in and youth that are in residential settings, such as psychiatric healthcare facilities, juvenile detention, and crisis housing. So if they are offered education in those settings, they are allowed to have very limited in-person instruction in those specific settings. So while we are increasing the activities, we know that we're going to see increased cases, but we want to allow these activities in a gradual way so we can see the impact. The last time we had a shelter in place order instituted was 6 weeks ago. So we're very, very slow in terms of our movement and allowing these activities. We're actually more restrictive than any other jurisdiction in the Bay Area. We're finally allowing pools. That was something that was done in other jurisdictions earlier, and some of the other activities. So just wanted to mention that it's still very gradual. There are specific guidelines that are going to provide safeguards for those activities, so they can occur in that setting. In terms of other things that are occurring with the city that I wanted to give you update, our disease containment unit continues to work hard. We are continuing to add additional case investigators and contact tracers. We have not only staff from the city being added, we also have some staff redeployed from the state that the governor had pledged to jurisdictions. So we're utilizing that staffing, and it's a great partnership, and they are helping out. I also want to acknowledge some of our healthcare clinicians that are volunteers that have been working with us. Some have been redeployed because of the fires, and others setting and emergencies throughout the state, but they have definitely been helpful. And I just want to give out a thanks to those individuals that have supported us. And we are doing well with our contact tracers and our case interviewers. I do want to ask the community that if you do get a call from the city, please answer it. We need to get information from you and help you, support you to be able to either isolate if you're a case, or to quarantine if you are a contact to a case. And we are there to support you so that we can continue to protect the community. Some of you may have heard a few weeks back that CalReady, which is the state's system for getting reports from both providers and labs for all communicable disease, was experiencing problems. Those issues have been resolved, and both our epidemiologists and our disease containment team have processed all the delays in the labs that were impacted because of this technical issue with the state. So our numbers are up to date with both cases and labs that are submitted to us. In terms of testing, we have the 2 test sites that are being supported by City of Berkeley. The Optum test site, which is a state supported site, is continuing. And that is state-run site that's supported by City of Berkeley staff, and our 6th Street site, which also has a mobile component. The mobile component is used for targeted testing. We're continuing to use that to focus on certain high-risk communities and certain populations that need access to on-site testing. So some of those places continue to be grocery stores, our long-term care facilities. We are working with churches, with community-based organizations such as the Multicultural Institute and Latinos Unidos for the Latinx community. So we continue to provide those services. Just wanted to update the community on that. We also have our pilot curative site, which is outdoors. So that site ceased operations at the end of this week because of the air quality, but we're working with them to have them come back to complete that pilot testing. I want to end with a little update on schools. As people know, Berkeley Unified School District is online, and they decided to go online before the decision was made by the state to have all schools in counties on a watch list be online. So that was great, so that they were prepared to continue with that mandate by the state. We continue as a county to be on that watch list. So we are working with BUSD and other schools to support them with their online learning, and also support them as we prepare for in-person instruction that will happen sometime in the future. There is also the opportunity for waivers, and we're working with the county on a potential for us to have waivers for specific situations with, again, guardrails and assurances that there is a safe reopening if they're allowed for schools, for both safety for the students, the staff, and the community. Speaking of safe reopening and community relationships, we are working closely also with UC Berkeley. I continue, and I'm sure other parts of the city staff have been working with UC Berkeley in terms of their reopening. This week they had certain starting Thursday on campus housing was opened, and the move-in started with very rigid testing for those students on coming on campus, with also quarantining of those students before they are allowed to be able to actually be out of their rooms. So we're working with UC Berkeley and UC Tang, great partner with them. We're also working with the off-campus housing, whether it be the Greek community or the co-ops and other community. We're also working with them to ensure that they are compliant and also have opportunity for testing. So I'll stop there. with my update, and I'm looking forward to the questions that that we'll be having in a bit.
Thank you so much, Dr. Hernandez, for the update, and thank you for all your incredible work to protect our community. We greatly appreciate it. So I'm now going to go to our Deputy City Manager, Paul Budenhagen, and we're fortunate to have Paul here today because he's also the EOC coordinator. So Mr. Deputy City Manager, welcome, and you can update us on city operations and anything else you'd like to share with the Berkeley community. One particular question I have, which I hope you can answer, is the new order allows pools to open. What is the timeline for our municipal pools to open?
Sure. Thank you, Mr. Mayor. Glad to be joining you and Dr. Hernandez here today. I'll start just by echoing the sentiments of Dr. Hernandez and you, Mr. Mayor, to people in the city who have families or who themselves have lost houses or been evacuated out of surrounding areas. We have staff who have lost houses and who have families who have been evacuated and who are dealing simultaneously with trying to manage that, as well as dealing with COVID and doing their work. So, it remains, we anticipated this fire season would have events like this. This is bigger than we anticipated and earlier than we anticipated, but it is still devastating, and want to offer my condolences and support from the city for people who are experiencing that. So that said, we continue to, let me just say one more quick thing about that, which is that we're going to issue a red flag warning today. We're anticipating another potential lightning event starting Sunday through Tuesday, which is a possibility. Our Office of Emergency Services is monitoring that very closely, and our fire department is on high alert for that. So just want to give folks reassurance that we are closely watching that. Also very closely watching wind conditions and air quality conditions, and prepared to respond should those worsen. So with that out of the way, in terms of COVID, we continue still as a city to have to be operational and functional. Very proud of all the work that staff are doing and the ability to pivot to working remotely, but still providing city services very strongly. We have, as you just said, Mr. Mayor and Dr. Hernandez, the pools will be allowed to open in this next iteration of the order. We have been working to get lifeguards certified and bring lifeguards on board. However, that's not going to happen right away. Lifeguards need to be recertified, and with the pandemic, they haven't been recertified. And also, we have staff who are choosing not to come back to work who were lifeguards. So our anticipation is that by mid-September, we would be staffed and have our pools open. And just want folks to know we're working as hard as we can to bring staff on, get them certified, and get the pools open. We know that in this time, there's so few venues for people to have experiences that are positive, and that pools would be one of those very positive things, as long as we can do them safely, which we will do with the health order, and we'll continue to move as quickly as we can to get people on board to operate our pools. With that, I think in terms of city services, we continue to function as we have functioned. I'll say also, we have 1,500 employees, and we're not immune to COVID. So we have had and will have staff who are COVID positive, and when that happens, that will disrupt the work. It will be pockets of disruption, and we'll notify people who might be disrupted by the delays in something, whatever that might be in terms of city services. We do have redundancies in place often, so we can just sort of pick up and continue to move on. But there will be times when things get slowed down, and when that happens, we'll notify folks. So with that, I'll stop and we can get into questions.
Thank you very much, Mr. Budenhagen. I want to go to a couple questions that were typed into Facebook, and then we'll go to the actual questions submitted. One question was, how can we support our friends and loved ones who are evacuating from the fires? I don't know if, Mr. Budenhagen, you're aware of any ways that people can donate or volunteer. We're happy to share information afterwards about ways that people can support. Obviously, if people have to evacuate, we need to find places for people to evacuate to.
Yeah, we don't have that set up right now for people who have to evacuate. I'll say as we do, we'll put it up on our website. And I think, a lot of it is going to be similar to with the COVID. I mean,
Yeah.
the sort of mental health impacts of COVID and now the fires and the air quality on top of that are significant. And so, we need to continue as a community to support one another as best we can through communicating, staying in touch, being proactive in the ways that we reach out to our loved ones and our families. And I know that all of you and people out there are doing that, and that's something that we'll continue to do as we as a city, create ways for people to donate and or shelter. We will provide that information on our website and through the mayor's channels as well.
Thank you. Yeah, I want to touch on something both of you had talked about, which is, some of our city employees have been directly impacted by the fires and have lost their homes, including firefighters who are up there bravely risking their lives to support our neighbors. And despite them and their losses, they're still putting their lives on the line. I just want to express my deepest appreciation to our first responders, our police and fire personnel who are up there assisting in Sonoma and Napa in helping control the spread of these fires. And thank the city manager's office for agreeing to dispatching our staff to support our neighbors. A question from Councilmember Harrison. Hi, Councilmember Harrison. And I don't know if Dr. Hernandez is able to answer this. If not, then we can ask the superintendent and share the information. But the question was, what is happening with on-site instruction for K-12 students with IIPs? Superintendent Stevens, unfortunately, was not able to join us today, but we hope to have him at a future town hall. I don't know, Dr. Hernandez, if you have any information about that, we can ask the superintendent and share information as well.
Yeah, I think he would be the best person to answer that question. I don't have those specifics.
Thank you. So, Councilor Harrison, we'll ask the superintendent. We'll provide that information to you and share it. I know that some parents are very concerned. It's a huge burden on children with IIPs, and we are in conversation with the school district about the issue of childcare and support for families of essential workers and low-income families in Berkeley. I'm personally very concerned about Black and Brown students and low-income students whose parents have to work full time. Who's going to look after them? Who's going to help them do their distance learning? So please know these are issues we're very concerned about. We're working very actively on and working in partnership with the school district to address. So let's now go to questions. We had a number of questions that were submitted. And the first is about childcare. What is being done to provide childcare for school-age children of essential workers? And I think I touched on that a little bit, Mr. Budenhagen, but if there's anything else you want to add.
Yeah, I can add a little bit more about that. From the city perspective, we are providing after-school care from 2 to 6 every day, 5 days a week, through our Parks and Recreation Department. And we have currently 180 kids who are signed up and participating in that. We've planned it out to do 2 4-week blocks. The first block started on August 17th and it'll run through September 11th. And then we'll have another block that starts up on September 14th and goes for another 4 weeks. And to the point you just made, our first priority was providing that option for low-income Black and Brown families. And so that was the group that we really focused on getting registered first. And we had about 40 kids out of that 180 who signed up first for that childcare resource in that population. And then the balance came through other folks. So that we, are also in close coordination and communication with the school district on. And as we get into October and hopefully another iteration of education, hopefully shifting to in-person, although, obviously we'll see, we'll also have our childcare services sort of align with that in ways that support families as best we can. So really want to thank our Parks and Rec staff who've worked very hard to set that all up. Thank our health officer who worked in close coordination with them to make sure that the way that they set it up was safe and was in alignment with the health order. And that's kind of where we are on that.
Can I add one thing, Mr. Mayor?
Yes.
One thing in the order that is new that I didn't highlight was that in terms of the extracurricular youth childcare bubble, we've expanded the size of the bubbles to 15 kids as opposed to 12. So that also will give other childcare providers and the ability to expand the size of those bubbles for the 3-week period that they can be together. So that's another thing that I didn't highlight or mention, but this might help answer the question from the person who asked it.
Thank you so much.
Mm-hmm.
Next question, Mr. Budenhagen. Have there been any changes to city services since our last town hall a month ago? How many city employees continue to work on our city's response to COVID-19?
No significant changes to city services. We continue to be fully operational. Like I said, though, we will have the little pockets of COVID positive that impact services from time to time. In terms of the EOC response, the Emergency Operations Center response to COVID, when we first activated, we had somewhere around 150 to 175 people who were activated. That's when we were really putting the whole thing together. As of this week, we're at around 75 people who are activated, and they're providing services, to support the response in a lot of different ways. So, for example, we have 8 to 12 staff people who are assigned to the test sites so that we can manage and keep those test sites functioning. We have folks who are working on our cost recovery so that we can, follow all the FEMA procedures and guidelines and make sure that we're recovering as much FEMA reimbursable dollars as possible. We have a huge, as Dr. Hernandez described, just sort of the health focused piece of it around disease containment, around contact tracing, around case investigation. We have, we're looking at, so for example, right now, as Dr. Hernandez said, with the curative site being closed for the poor weather, we're looking at possibly moving that inside. So we've got a couple of staff who we would shift to figuring out, how do we get air purifiers? How do we find a site? How do we locate it? How do we notice it? And then the other big part of this has been communications. So we have a very active communications group, our Joint Information Center, that's put out lots of information, but that also takes, pull staff off of, out of the clerk's office and out of the libraries to focus on how do we communicate with our city citizens. So, so very proud of all the work that everybody's doing right now, probably about 75 people.
Thank you so much. Okay, next question. How is the city providing increased mental health and substance abuse treatment resources along with housing for people suffering during the current crises?
In terms of the mental health, I would say, the best thing to do is look at the city's COVID-19 webpage. There's a lot of resources on there for mental health. There's a section on that webpage called Health and Safety, and under that tab, there's resources that people can look at. So there's 4 little sections there. One's called Things You Can Do to Support Yourself, and there's a bunch of suggestions there. There's a page on how you can connect with others. We know that, one of the biggest impacts has been the disconnection that we've all felt as social creatures, and some suggestions and ideas about how we can better connect. There's a whole section on supporting children and teens through this. As a parent of a couple of teens, I see firsthand the impact that this has had on them and their own mental health, being completely isolated from their friends. Except for video games at night when they had their headset on. And then resources, then there's another one on resources for community and peer crisis and peer support. And that section has phone numbers that people can call for the California's Peer Run Warm Line, the 24-hour crisis support line that the county runs, our own Berkeley Mental Health Crisis Triage line. And then there's a special line set up also for BUSD students and families and teachers. All of that information is on the city's COVID-19 webpage, and is something that I hope people will have a look at. In terms of the services for substance abuse and unhoused people. We continue to have staff who go out every week to talk with folks that are living on our streets, that to provide them with both public health information, a connection to services. We just got a big shipment of KN95 masks that we're distributing to people who are living on our streets to support them through this the bad air. So maybe I'll just leave it there and really direct people to that webpage for mental health resources.
Thank you very much. Next question, should the city be enforcing no smoking in public to reduce the risk of COVID infection?
Yeah,
And-
I guess, maybe that's somewhat of a question for Dr. Hernandez on the health side. I think, I haven't seen any research that shows that COVID-19 is transmitted through smoke, that people from people's cigarettes. It may be that the smoke is sort of an indicator that you can smell it. Therefore, there are airborne particles that somebody is exhaling that you are in the vicinity of. And if they have COVID, you may be exposed to that. But in terms of an actual direct connection between smoking and COVID, I don't think one exists in terms of transmission. So I don't know if Dr. Hernandez has anything to add to that. Or
The only thing I'll add, you're correct, Mr. Deputy Mayor. However,
that's my next aspiration.
sorry, the title.
That's right.
Okay, Mr. Deputy Manager. In terms of risk, you're exactly correct, though. I will use this as an opportunity to say that, we really want to encourage people to be healthy during any time, but especially during this time, and when we're dealing with both in terms of risk, in terms of both the COVID pandemic and our poor air quality. We want our lung health to be as positive and good as possible. So I would say that's one thing I want to encourage people to do, to use this as an opportunity to consider not to end smoking. I know it's tough to do. Believe me, I had both my parents were smokers for years, and they both stopped smoking. So I want to say that I know how tough it is, but this is a great opportunity to do that, knowing that you're more you're worried about other lung conditions such as COVID.
Yeah, I've certainly read articles about the fact that smoking does sort of heighten the risk of contracting certain respiratory illnesses, and so it is definitely something that we should be mindful of. And as Dr. Hernandez says, always listen to the doctor. That we should, if you are a smoker, to cut back on smoking so that you are keeping yourself safe. So last question, Mr. Boonhagen, what is the status of outdoor retail and dining expansion? One of the questions, when can salons open? We just addressed that at the beginning. It's part of the new health order starting this Friday, this next Friday, I believe. Outdoor salons can operate under the health guidelines. So I know that a prior health order did allow outdoor dining and certain outdoor business activity, and those business activities have been occurring under the health officer's order. But anything else you want to share, Mr. Boonhagen, about outdoor retail and dining expansion?
I think that's you kind of covered it. We definitely have had businesses start to do outdoor dining, which is great. If you go along 4th Street or even on downtown, you'll see some also. We continue to support the safe opening of outdoor dining. One thing that we'll have to consider and think about as we get into the winter season is how does that happen safely when the weather turns colder? As a health jurisdiction, what does that look like in terms of any sort of protection from wind, any sort of exterior heating that could be allowed? So those are things that we're starting to think about. And we need to accelerate our thinking in terms of that as we head in. I know it seems weird to talk about heading into winter when it's so hot and smoky out, but we'll be there before too long. So, so that is something that we're working on. And, we have a whole economic development team that is working very hard to support our business community in every way they can, including outdoor retail and dining. And they continue to do that. So if there's folks from the business community who are watching, you can contact our Office of Economic Development, and they stand ready to support you in moving forward with your work.
And I'll just note that the City of Berkeley's website, cityofberkeley.info/COVID-19, has information if you are a small business and would like to get permits to build a parklet or to operate outdoors. And we've streamlined the permitting process. These permits are granted ministerially by our staff. And so we are working hard to try to enable our businesses to be able to safely operate outside under the health officer's order. Council also adopted, I think, several pieces of legislation to enable outdoor activity, not just on our streets, but also on private parking lots and other private space. So if you are a business and you are interested in expanding, please go to our city website and be happy to help you. Okay, so I'm now going to go to Dr. Hernandez. There are a number of health-related questions. The first question, which I'm sure is something that we're all thinking about given the poor air quality that we're experiencing in the Bay Area, does bad air quality increase the risk of contracting COVID-19? And does it increase the severity of symptoms?
So as far as we know, it does not increase the risk or the severity. I will say that if you happen to be irritated by the air quality and you're infected with COVID and you're coughing, then that's something that is going to put others around you at risk for getting COVID-19, but not the specific poor air quality. It's just more of your reaction to the poor air quality. So I want to use this as an opportunity to encourage people to stay indoors as much as possible. And to make sure that if they have air conditioning, to make sure that it goes on recirculate, so they're not bringing the air particles inside, smoke particles inside, and also not to. We want to make sure that the N95s that are available for our first responders and those that have to work outside and cannot come indoors safely. So I just want to give this as a reminder that we do still have some challenges with the supply chain for N95s for healthcare providers. And we're seeing that throughout the state and nationally. So we don't want to further impact that. So the best thing is to stay indoors and to leave the N95 respirators to those that truly, truly need it in these responses. And I'll stop there.
Thank you. There's a question about the curative testing pilot. This individual had said that the testing pilot is a great option. It's only temporary. Are there any plans at this point to make it permanent, as well as move testing inside due to poor air quality? You had touched upon this, Dr. Hernandez, that it's been suspended, but we're working to try to resume the testing.
Correct. And as the deputy city manager mentioned, there seems to be, we're planning, seeing if there are any contingency plans in terms of bringing them indoors with specific protections for them and for the community. And it's a pilot, but we are looking to try to have additional opportunities for testing, whether it's with Curative or other partners. So we're always looking to ensure that we have adequate testing in our communities.
Thank you.
Add a tiny bit onto that. We definitely want to increase our testing capacity, as Dr. Hernandez has said. And Curative, it sounds like Curative is interested in making the pilot more of a permanent feature, which we would be interested in as well. So we'll see, part of the goal was to have this 2 or plus week pilot period to figure out what the usage patterns were like, what the insured versus non-insured patterns were like, who was getting tested from where, and then to be able to have enough data for us to really have a good discussion with Curative and sort of internally and think through, would this be a good long-term prospect for us? And so that's the next sort of analysis and sort of discussion that we'll have once they resume and then conclude and we have that data.
Excellent. Yeah, I'll just say that I actually went down there a couple of weeks ago to get tested, and it was very quick. You know, a minute or 2 minutes. I got my test results a little over 24 hours after I was tested. And so this is really a great service that we are providing, which will also enable us to have these kiosks at different locations in Berkeley. So I'm very glad to hear about our conversations with Curative and the potential for making this more long-term. So I want to thank you all for making this happen.
Yeah, can I add just one more quick thing, which is that if we're able to get a fairly high volume, high quality, fast turnaround test site, something like Curative or something else in place, that will allow us to transition one of our existing test sites, the one on 6th Street, into more of a mobile test site that really focuses on testing folks who otherwise wouldn't be able to be tested and are in high risk groups, whether that's low income people or people living on our streets, people who have higher rates of COVID in the sort of Latinx or African American communities, and really focus on really targeted, careful testing for people who might not come to the Curative site. So it would have a dual benefit if we can get something like that going, and that would be our intent.
Excellent. Dr. Hernandez, a question about data. Would the city consider sharing non-private information about how people are contracting the virus? For example, how much percentage of people contracted in nursing homes, large gatherings? And this resident felt that information like that could help people avoid potentially dangerous situations. I know that you've touched in the past around, you know, particularly when we did have infections in our nursing homes, the number of people that were infected who were living in nursing homes. But anything else you'd like to add about that?
So I agree with the resident who asked the question. That information would be helpful. We have increased some of the information that's out on our web in terms of demographics. We have age, and if it's not posted yet, we will have ethnicity also posted. And each type of information that we release has to go through a very rigorous process to make sure that that we assure privacy of our community. We have just over 120,000 residents, which limits our ability to be able to present the data in the way that other jurisdictions do. But I absolutely, if our next project is looking at places of exposure in buckets, so that people have that information. In terms of long-term care facilities, that data is already publicly available, both on the state site, and Alameda County has that available and posted with specific information from the facilities. We're working with each of the facilities to assure that they're doing their testing. They have what's called surveillance testing, where every month all of their staff is tested. Any new residents that come in have to be tested. And with that schedule, we have not seen any cases in residents at the facilities. So this is definitely a big method or strategy to control disease. Also, we know that the facilities have even improved on their personal protective equipment and infection control practices specific to COVID. So that definitely has helped as well.
Thank you. There's a question around Alta Bates asking if the city has any oversight responsibility with COVID patients at Alta Bates. This resident had heard from an Alta Bates nurse that they are not in a separate wing, but mixed in with other patients, and it makes it difficult for nurses who have to don PPE and decontaminate themselves whenever they're around non-COVID patients.
So we don't have jurisdiction over how they, the Alta Bates organizes their wards in terms of where the patients are placed. They are definitely doing protecting their staff and their community. We haven't had any concerns or seen transmission in that. Though I can't comment on that. Sounds like something that the staff can work with the leadership of Alter Bates on in terms of best ways to organize their medical wards. But we don't direct them on how they construct or organize those units.
Thank you. There was a question around, and this might also be a question we might want to direct to Superintendent Stevens when he joins us at a future town hall. But a question around sort of student extracurricular activity. First, this resident wants to thank Superintendent Stevens and BOSD for a good start of the academic year. The change from spring to fall is remarkable. But this question specifically, I think, is for the public health officer as it relates to school-age children. Many children are attending afternoon, evening sports camps, and some parents also want to engage their children in social, emotional, outdoor play with friends wearing face coverings. How should parents balance the extracurricular exposure and limited friend exposure from extracurricular activities and limited social activities given the social bubble guidance? I know you touched upon the social bubble is actually, that number is increased to now 15.
Right, but what hasn't changed is the requirement that you have one the child only gets one of those childcare extracurricular bubbles in a 3-week period. So one child can be in their parent household bubble, socializing in that, and a extracurricular / childcare bubble, and that's it. They can't have multiple childcare extracurricular bubbles occurring at one time. They get one. Now it can be with 3 additional people, so it's 15 as opposed to 12, but that does not change that exposure, and that is limited for 3-week intervals. So that child could be in a bubble for 3 weeks for violin, and then 3 weeks later jump in the pool now and swim in another bubble. So that's the limitation and the guidance that is outlined in the health officer order, and hopefully it provides some clarification on that for the person who asked the question.
Thank you very much. A couple of questions around testing. This resident is asymptomatic and at low risk because of their situation and behaviors. Testing kits are in short supply and labs overwhelmed. This individual doesn't see a good reason to be tested now. And I guess it's asking the city of Berkeley, should they get tested given limited supply and the time it takes for labs to process tests? Is this helpful to the city in helping control the spread of COVID?
So I'll address the first part of that comment / question in terms of the availability of tests and the turnaround times. Those are getting better, both with our Optum site. Our 6th Street site has always been pretty good with their turnaround. We never had that challenge with our lab and through our partnership with UC Berkeley. In terms of the other commercial labs, those that are offered by providers and throughout the region and state, those were having problems with turnaround time, and exactly right. We were seeing challenges with that and being able to control disease because the data was coming back when it was too late. So we are seeing an improvement in that. In terms of why should you get tested if you're not sick, we know that there are people who are asymptomatic that do have COVID, and we also know we need to know how disease is circulating throughout the community. So if you feel we offer the testing if you feel that you're at risk, you should get tested, whether you're symptomatic or not. And that's how we use the test. If you happen to feel that you've been exposed or you're worried, you're in a high risk setting because of your work or any other exposure, we want you to get tested whether you're symptomatic or not.
Okay, thank you very much. One last question, Dr. Hernandez, about the reliability of testing. This resident asks, I'm hearing conflicting reports on the reliability of tests. How reliable are the Berkeley tests, including antibody tests? Dr. Hernandez, did you hear the question?
She frozen?
I think the connection is
So
frozen.
City of Berkeley doesn't offer the antibody test. Antibody tests still are not being used for diagnosis. Is my connection unstable? So Berkeley,
Yes, it
those tests.
frozen a little bit, but we can
Should
hear.
You can hear me, but you can't. I'm frozen.
No, it's not frozen anymore.
Okay.
Okay.
Should I repeat my response, or where did I get stuck?
I think you were saying that the city of Berkeley does not do antibody tests.
Okay. So City of Berkeley's test, we don't do antibody testing. The state and the city do not recommend those testing, the antibody test for diagnosis. There's limited value in using those tests for even surveillance, but they have been used in other settings. But we don't offer them. In terms of the tests that we do offer, the PCR viral test, those are reliable and are the ones that are being used both at our Optum site and our site on 6th and University.
Okay, thank you very much, Dr. Hernandez, for answering those questions. We really appreciate it. I'm going to take the last set of questions before we wrap up. There was a question about when the city is considering stronger mask enforcement. This resident walked by an outdoor party on the 1400 block of Ward Street, and there were 18 people without masks in close proximity to one another. They called BPD's non-emergency number, who told them to call 311. When will we begin enforcement? Well, we encourage you, if you see those types of instances, to please call the non-emergency number 981-5900. I do want to let the community know that on September 15th, the first meeting back after our summer recess, the council will be considering a proposal to consider the levying of fines for people that are not complying with the face covering requirement. And while we have generally good compliance citywide, we do have instances like this, including as well frat parties and parties in congregate living situations. And this is very risky behavior that can result in people contracting COVID-19. And while we encourage voluntary compliance, we do need to ensure that if people are breaking the law, that they are held accountable. So the council will be considering that proposal about whether to levy fines. We welcome your input. If you have an opinion about that, please email us at council@cityofberkeley.info. And I personally think that this is an important tool for the city to have, to use, to not use all the time, but to use if necessary, to address flagrant violations and activity which is posing a risk to the safety of our community. Because at the end of the day, it's about protecting everyone's safety. So we welcome your input, and once again, we'll be taking that up on September 15th. There was a question about information that's being sort of disseminated in the community around our health orders and about whether the city's contemplating an information campaign. And happy to report that we're actually working in partnership with Alameda County on an information campaign that we'll be launching soon, including posters and banners about the importance of people to wear face coverings and to follow the health orders. And I think the slogan is mask on to move on. So once again, wear your face covering so we can move forward as a community out of this pandemic. So please stay tuned for information about that public information campaign. I want to acknowledge all the work our staff have done. We have banners on the front of 1947 Center Street and 2180 Milvia, encouraging people to get tested, to socially distance and wear face coverings. We have signs, hundreds of signs have been distributed in parks and other public spaces, also encouraging people to socially distance and wear a face covering. And we will continue to educate the community about these important requirements. There was a question about the university and students coming back to live in the dorms. I want to note that since our last town hall, the university announced that they're doing exclusively distance learning, but we do note that some students are choosing to live in campus housing and some students are choosing to live off campus. And so I received a number of emails and phone calls from residents concerned about the return of students, particularly given what happened this summer, where there were frat parties and other parties that happened and where young people were exposed. So what will Berkeley do to stop this type of risky behavior? I want everyone to know that we are working with the university very closely on this issue. The university has placed strict protocols during move-in, as we discussed. The move-in period will be stretched over 4 days, accommodating 600 students each day, all of which will be tested. They are required to have to isolate, for, I think, up to 14 days. And the city is working with the university to protect the health of our community. Frat parties are banned. We know that the Pac-12 will not be having football games. And we will be working with the university on the issue of education of students and enforcement to make sure that we can address potentially risky behavior to protect our students and our community. And the last question is around the election. What is Berkeley going to do to keep people safe at polling locations? Have we been in touch with the Postal Service about the delivery of absentee ballots? I actually would like to direct that to Mr. Budenhagen, but I can just open by saying that in California, everyone will get a mail ballot. And we have at least one absentee ballot drop-off station in front of City Hall at 2180 Milvia. I know there's a drop box on campus. I will be reaching out to the county about whether we can get more drop boxes. I mean, we need more drop boxes countywide to safely ensure that people can actually send in their ballot, particularly given the concerns around the U.S. Postal Service. I will note that the Postmaster General, after much pressure from people throughout the country, is saying that they're not going to move ahead with some of the more, I think, unacceptable changes to the Postal Service, which will impact people's participation in voting. But Mr. Budenhagen, I don't know if there's anything else you'd like to add about that particular matter.
I think you've covered it. We have a fantastic clerk's office who's really on top of all this, but you've covered the main points.
Yeah, and I just want to note, I've been in the clerk's office a lot over the past couple of weeks, and they've done really a tremendous job of adjusting their operations and doing so safely. And I just want to commend our city clerk and staff in the clerk department for continuing to administer our elections and all their other responsibilities, but to do so safely. And we take very seriously the threats to our postal service. In fact, on my way here, there was a large protest in front of our main post office in downtown Berkeley, several hundred people who were speaking out about Trump's attacks on the postal service and the impact it's going to have on people to exercise their constitutional right to vote. We take this very seriously, and while in Alameda County, our registrar of voters and our city clerk are working hard to ensure the safe and fair conduct of our election, we know nationally this is a very serious issue, and we need to continue to speak out and hold the federal government accountable. There were a couple of comments about lawnmowers, city using gas-powered lawnmowers, and then a comment about wood burning. And we are in a spare the air period, given the poor air quality. So people should not be burning their fireplaces or barbecuing. Please follow the spare the air guidance. So those were all the questions that we have received for this week's town hall. And I want to take this opportunity to once again thank Dr. Hernandez and Mr. Budenhagen and all of our city staff for their excellent work. We're so fortunate to have such dedicated public servants serving our community and working so hard around the clock to keep us safe. And thank you for taking time out of your weekend to engage with the Berkeley community. I know our residents really appreciate it. And before I turn it over to Mr. Budenhagen and Dr. Hernandez to make some parting thoughts, once again, please stay vigilant. Wear a face covering, wash your hands, socially distance, and shelter in place. All are essential to control the spread of this virus. I want to thank the Berkeley community for really stepping up and looking out for each other. Please continue to protect yourself and protect others. We can get through this as a community, and we'll be even stronger as a community. So, Mr. Budenhagen, anything else you'd like to add before we close?
You've said it all beautifully. Thank you for the opportunity to be here.
Thank you. Dr. Hernandez.
I was going to say the same exact thing, Mr. Mayor. Those three things: washing your hands, wearing face coverings, and staying home, unless you absolutely need to go out, still are the best practices. So nothing else to say.
Thank you. So we do encourage people to stay indoors with this poor air quality as much as possible. So please, everyone, be safe. Please remember to, once again, wear a face covering, wash your hands, socially distance, and shelter in place. We will be doing another town hall in 2 weeks. And so stay tuned for information about that date, as well as an opportunity to submit questions. And once again, on behalf of the City of Berkeley, please stay safe. Thank you all, and have a good afternoon.